Hi everyone, welcome to this episode of Mary's Health Chat. Today we are so excited to be hosting a very special guest in the podcast. He is a nurse and a registered midwife, a certified humanitarian. He is a pioneer SUG president of Abia State College of Nursing Sciences, Aba Campus Department of Midwifery. Please join me as we welcome this special guest in our podcast today, in the person of registered midwife Chukwemeka Gosin. Welcome to Mary's Health Chat.
So thank you so much for having me.
You're welcome. Today we'll be discussing on hypertension. What exactly is this hypertension? I know that a lot of people are suffering from this without knowing what is causing it and what this hypertension is all about. So, sir, can you help us with the definition of hypertension?
So hypertension is a medical condition that results as a result of too much pressure on the arteries of the blood vessels.
Okay.
And it is most times it comes without symptoms.
Okay.
And also someone is said to be hypertensive when the systolic and diastolic reads 140/90 over 3 times or 4 times when checked in the clinic.
Oh, wow. Thank you so much. That was a very beautiful definition of hypertension, and I know that you were able to grab what he said. Let's go over to knowing the predisposing factors of this hypertension. What exactly can lead us to having hypertension, or what can cause hypertension? So, sir, can you help us with the predisposing factor of this hypertension?
So many things can predispose you to having hypertension. Firstly, you consider age. Most persons who are older have the high chance to be hypertensive. Like the older you get, the more your chances of being hypertensive increases. Then most persons who have this family history of hypertension, that is those that are in their gene. That is their grandfathers were hypertensive, their father and themselves stands high chance of having this medical condition, hypertension. Now also you also understand that stress can also make you to be hypertensive. When you work and overwork yourself, you don't have time for rest. That is, it can make you to be hypertensive. Now, another factor there is some person who have high body weight. That is, they are obese. Their body mass index is so high. Their chances of being hypertensive is also very, very high. Then some persons don't live good lifestyles. That is, they indulge in sedimentary lives of alcoholism and smoking. Whenever you smoke, you predispose your arteries and blood vessels to become thin and thinner. And as they are more thin, it would cause more pressure to transport the blood to other systems, to your body parts. So if you are indulging in smoking and alcoholism, it can cause you to be hypertensive over time.
Thank you so much. That was a very wonderful explanation on the predisposing factors of hypertension. A lot of questions have been coming. No, midwife, how do I get to know that I'm hypertensive? Some people ask this question a lot, and we're going to be discussing it today. So, sir, can you enlighten us on how to know that one is hypertensive and tell us the normal range of the blood pressure?
Okay. Before you conclude that someone is hypertensive, this person should record at least 3 to 4 times occasions of having a BP reading of 140/90 or above. That is your first visit, second, third, or fourth. It is reading 140/90 and above. But the normal blood pressure for a normal person, a normal adult, should be 120/80. That is, the systolic should be 120 and the diastolic should be 80.
Okay, let's get to know the signs and symptoms. What an individual notice in themselves, or what you will notice in an individual to know that they have this hypertension. So, can you help us with the signs and symptoms of hypertension?
Most persons with hypertension don't have obvious signs and symptoms, but there are some symptoms or signs you have that you would suspect hypertension. For example, when you are becoming easily tired, that is, if you even having dizziness, then sometimes you begin to have blur visions. Blur vision is also a very important symptom of any cardiac abnormality or any medical abnormality. Then sometimes you would feel that you have blood from your nose, that is bleeding from the nose to epistasis. This is a very, very obvious sign that you might be suffering from this medical condition of being hypertensive. In addition, most persons who are hypertensive might experience symptoms of chest pain. It might be severe or it might come in episodes. Then also some persons who are very, very, very hypertensive might start feeling tired. Maybe you come back from work, you just feel unnecessarily tired, unlike before. It is also a very important signs or symptoms of hypertension. Then someone who is also hypertensive might start having breathing issues or shortness of breath over little tasks done at home or in the workplace. So these symptoms are not just normal symptoms that you just overlook. Sometimes there are indications of hypertension or that you actually having a very high blood pressure. Thank you so much.
Thank you very much. That was a very good and detailed signs and symptoms of hypertension. Let's go back and ask our special guest what advice you have for the people, our viewers out there.
Okay, my advice is this. We're in a country called Nigeria. We need to be mindful of what we eat. If you want to limit your chance of being hypertensive, you need to understand that you should take more of natural fruits, mostly fruits and vegetables. And also you should avoid high sodium intake because sodium will predispose you to being hypertensive. Then most people enjoy fatty foods because eating fatty food it will occlude your blood vessels and make the movement of the blood vessels narrow, thereby making it more harder for your heart to pump the blood effectively. That means leading you to being hypertensive. Then also you need to take your rest serious. Observe good daily rest. Avoid so much stress, and then avoid some lifestyle that will dispose you to being hypertensive, such as alcoholism and excessive smoking.
Thank you so much for your wonderful lecture. You have all heard what we have to say about hypertension, ranging from the definition, the predisposing factors, the signs and symptoms, and the advice you have to give you guys. I urge you to adopt what you have said now and make sure that you live a very good lifestyle. Avoid smoking, avoid alcoholism. Let's make our world a very good place. Don't forget to subscribe to my channel. Don't forget to like and drop your comments. If there's anything you want us to talk about, please drop it in the comment section. Don't forget to share to your friends, your family members. Let's make the world a better place. Bye for now.